Everyone, this is Dr. Naveed Shah. I'm a board-certified pulmonologist and sleep medicine specialist coming to you from Maryland. Today is a very cold day. I want to thank everyone to coming on board. I want to welcome everyone. This is a question and answer session, so let me know your questions, and I'll be happy to try to answer them as best as I can. And if you have not done so already, please sign up with mynewlungs.com. It is the best pulmonary rehab out there, probably in the world. And those people that are in it already know how good it is and how good our therapists are, especially Alex and Melanie. So please, if you have not done so, mynewlungs.com. To get yourself enrolled in the pulmonary rehab. It's online. You do not have to go anywhere. It's through a secured Zoom. You can do the videos on your own. You can join with a therapist. It's really up to you. Would recommend with a therapist, however, but it's really up to you. It's pretty cheap. Probably you spend more in co-pays or many other things, but this will really help you in your life. And if you sign up now, there's a coupon code GIFT25 that's 50% off your first month. You cannot beat that. You cannot beat that. So please sign up if you have not done so. You'll thank yourself later. So today is question and answer. Whatever questions, no question is too small or too big to answer. If I can answer it, I'll definitely answer it. If it's something I want to give you more detail about, I'll let you know, and maybe the next time I'll present it in a little bit more detail. Some questions require a little bit more details than others. Some questions are more comprehensive than others. So I just want to be fair and make sure that I answer the questions not just correctly, but in the best way that you can understand them. And now we're in this winter season. It kind of started off pretty cold, so make sure you're up to date with your vaccinations, including your flu shots, your RSV, pneumonia shots, and make sure that in certain areas, some people may need to wear masks because COVID is still out there. So especially in crowded areas, especially in the winter months, make sure you have your COVID vaccines as well and your boosters. This is also prime COPD exacerbation time due to many factors. In the cold weather, a lot of people do get dehydrated, so make sure you stay hydrated. Make sure you're getting adequate sunlight as well. And once you sign up with the My New Lungs, you'll have an idea of what type of exercises to do, not just breathing exercises, but overall body strengthening exercises, and also diet and nutrition are very important as well. We're seeing a good amount of flu this year, flu A mostly, but also some flu B as well. So preventing flu is really the best course of action, again, through the flu shot, and also being cognizant of where you are. If you are in crowded areas, if you're going to the store, if you are able to wear a mask, that'll be a good idea. If you're not able to wear a mask, then kind of go to sections where there are less people, and kind of reroute yourself to those areas more than areas that are more crowded. Um, so just be careful. Prevention is the best way to avoid the flu. The flu does cause a lot of difficulties for patients, especially with COPD, can cause you to be hospitalized with exacerbations, acute respiratory failure, pneumonia, and kind of loss of muscle mass, worsening breathing afterwards, weakness afterwards. So um, it it's definitely something that you want to try to avoid. Um, Also, um, the indoor heaters, the indoor um, air itself, um, also plays a role. So make sure that there's good ventilation, and the heat can be drying again, causing some dehydration. Be aware of that. We have a question. How much does the flu shot help? Have a friend had gotten the shot but also got the flu and is pretty sick. So that is the quintessential question, because a lot of people do get the flu shot but still end up getting the flu. So the flu shot is basically made up of what is predicted to be that variant for that year. So you could get the flu, but there are many other viruses that cause flu or flu-like disease. So maybe you didn't get that flu, but you got something else. So just by getting the flu shot doesn't mean that you're not going to get sick, or you're not going to get um, the flu per se. So again, other ways to prevent it, as I mentioned, wearing a mask outside, washing your hands, not touching your face or your eyes unless you've washed your hands, staying away from crowded places. If you're on a flight or if you're in crowded areas, make sure you wear a mask if you can. So prevention is the best thing. Now, the flu shot is definitely part of the prevention, but again, there's many strains of flu. There's many strains of flu type of viruses out there, and there's many viruses out there. So um, it's kind of like protecting yourself from many different sides, not just getting the shot. So we have another question. My heart rate is around 85 to 89 until around noon. Then it seems to increase to 94 to 100. Is that normal if oxygen is above 88? So I would need more information, first of all, but there may be reasons why your heart rate is a little bit faster, depending on one, maybe the meal you're eating can increase your heart rate. Maybe you're more active afternoon than before. That could be another reason. Maybe there are other reasons. I would definitely need to know a little bit more. Maybe you're using your inhaler or nebulizer, and that could increase your heart rate. So if your oxygen level is above 88, it also depends where your oxygen level is. If your oxygen level is closer to the 88, your cardiac output or your heart rate may need to increase. So therefore your heart rate increases. So hopefully I answered part of that question, but definitely would need more information to answer that question. Also, as I mentioned, some people do take their nebulizers and inhalers, and they may take 2 or 3 different nebulizers or inhalers in the morning, and over a period of the next couple of hours, their heart rate can go up as a result. So if you are on a bronchodilator, for example, you are on Brovana, you're on albuterol, and you took your, let's say you have budesonide, Brovana in the morning, and then you took an albuterol, you can definitely have increased heart rate. But as I mentioned, the meals that you eat can also increase it, or if you're losing muscle mass, that can increase your heart rate as well. If there's any cardiac issue, that can also obviously increase your heart rate as well. So hopefully that answers the question. But you should try to keep a slight buffer as far as your oxygen level. If 88's your oxygen level, try to keep it around 90, just so you have a little bit of a buffer. So decreases in your oxygen level may increase your heart rate just to improve your cardiac output, meaning getting that blood out. So try to keep that little bit of a buffer. What other questions do you have? Again, mynewlungs.com. Please, if you have not signed up, we have a great promotion. Gift 25 is the promotion. It's 50% off your first month, and you can't beat that. So the top tier is $79 a month. That includes 3 days a week with a live therapist. If you're getting the first month, what is that, $40 for a whole month of a live therapist 3 times a week. I mean, it's unbelievable. And not only do you get the therapist, you're getting the videos, you're getting all the other extras. So it's amazing. It's an amazing promotion, and the therapy is amazing. So you're getting the best therapy in the world with that. So please sign up. What else is going on? So lately, I was in the hospital this morning. It was like 12 degrees. People coming in with COPD exacerbations, people coming in with pneumonias. Again, make sure you have your shots up to date. You're preventing these kind of things. Now, the other things that you want to be aware of is make sure your vitamin D level is good, make sure you're getting plenty of sunshine. Make sure the other thing is a lot of people use humidifiers. Make sure that they are ones without a filter. A lot of the humidifiers, it's hard to clean with the filter, and they can harbor certain bacteria. So use non-filter, the water that kind of, and make sure it's clean. And you clean it out regularly because it can harbor bacteria. Glenda says, I do not have heart issues, have had all tests. I think it may be increased activity. I do nebulizer 4 times a day. So again, back to the heart rate issue, the nebulizer 4 times a day may be the issue. Now, if you're taking a nebulizer 4 times a day and you're also on maintenance therapy, the question then is, do you really need that nebulizer 4 times a day? In other words, a lot of non-pulmonologists will put you on a regimen of albuterol, like short-acting bronchodilator 4 times a day. I usually say if you can sit for a minute, relax, get your breath back, then hold off on taking your inhaler or nebulizer. Now, if you have to do a lot of walking, you're in the mall, you're somewhere, and you can't really sit and relax, then it's okay. Go ahead and take your inhaler. But if you're at home and you can just relax, you can sit down, catch your breath, go about your business. If you need to sit down again, then I would save 1 or 2 nebs if I could during the day, if I didn't really need to use them. So Meanwhile, you're doing your maintenance inhalers or nebs. So continue to do the maintenance and see if you can decrease the amount of short-acting nebs or inhalers, which is typically the albuterol. Some people may be on Xopenex. It's supposed to not increase the heart rate as much, but it really, the studies didn't really pan that well for that. Um, so try to sit and relax uh, and breathe yourself out. And that breathing technique could be pursed lip breathing. We have a lot of breathing techniques with the My New Lungs, box breathing, other types of breathing. So you'll get to know some of these different breathing techniques and when to use them, how to use them. And I think it's very important. People don't realize how many different techniques of breathing there are out there. There's many. There's many. BO breathing, as I mentioned, box breathing, pursed lip breathing. That's just three, but there's maybe many, many more out there. So learning which technique at what time will definitely improve your stamina. Not to mention the other exercises that we do with the My New Lungs as well. So hopefully that also answers your question. Um, Let me know any other questions or any other comments. So what else is going on? We're seeing, again, we're seeing a lot of flu in the hospital. We're seeing a lot of pneumonia in the hospital. The pneumonia vaccine that you get is for pneumococcal pneumonia and a certain variant of that. So again, if you got the pneumonia shot and the booster, that saves you from, so the one is 21 valent, the other one is a booster, I believe for 13 valent type of pneumococcal. There are other types of pneumococcal out there. That is the number one cause of pneumonia in what we would call community-acquired pneumonia, meaning you haven't been in the hospital, you haven't been in a nursing home, you're just coming from the outside. That is called or considered community-acquired pneumonia. Even if you get that shot, again, prevention is the key. Washing your hands, staying away from crowds, having the vaccine, exercise, good nutrition, good diet, vitamin D, very important, vitamin C, very important, zinc is very important, getting enough proteins is very important. Most people with COPD, their diets are probably not um, a lot of people, whether you have some weight on you or you can't keep weight on you, either way, your muscle mass is probably below where it should be. Your vitamin D levels are probably below where they should be. So make sure that those are checked and that you have an adequate diet made up of good proteins, a lot of fiber, a lot of fluids, unless you have some heart issues, but a lot of fiber, a lot of fluids, good amount of protein. What's a good amount of protein? For a normal person, around 0.5 grams per kilogram. For COPD, 1 gram per kilogram. If you just got out of the hospital, it could be up to 2 grams per kilogram. So just be aware where you are on that spectrum, and that's how much protein that you would definitely need. Here's another question. Is it normal for heart rate to go from 83 to 93 just by standing? The answer is yes. As you stand, your blood vessels are going to constrict. Your heart rate's going to go a little fast. So that is absolutely normal. Now, if every time you stand up, you're getting dizzy or lightheaded, then there's maybe another issue. So it could be that you are dehydrated. Could be that you've lost a lot of weight, muscle mass. It could be that you have a heart problem. It could be you have what's called POTS. If you are getting lightheaded or dizzy, then that's something you want to see your doctor about. And with all the advice that I'm giving, you definitely want to see your doctor before you implement any of these things. Make sure that you're discussing this with your doctor. Another question I had, Pseudomonas pneumonia. Not sure if this is spelling. Had pneumonia shot, but still was in the hospital, and it did a lot of scarring. Okay. So I think you're talking about Pseudomonas. Pseudomonas, again, I mentioned the humidifiers. Pseudomonas likes water, so if you're taking hot baths, hot showers, water sauna, hot tubs, those kind of things, they can carry Pseudomonas. So you have to be careful. If you have diseased lungs, for example, COPD, or you have some scarring in your lungs, Pseudomonas loves your lungs because those areas don't have great blood supply, and Pseudomonas can kind of hang out there and kind of proliferate. Pseudomonas is something often that we cannot eradicate, but we can treat and subdue for a while, and unfortunately, oftentimes it comes back. So you have to be very careful with that type of pneumonia. Again, the pneumonia vaccine, there's no vaccine for Pseudomonas. The vaccine is for pneumococcal, which is strep pneumonia, which is typically what we would call community-acquired pneumonia. There is no vaccine for Pseudomonas. Again, best prevention, stay away from steam. Another place is water fountains. There's a big water fountain at a local hospital here, and that's not something that you want to be near that water fountain, because once that water turns into vapor, those little drops can carry fungus, can also carry Pseudomonas. So just be careful of any kind of water vapor, whether it be at home or outside. That is one way definitely to get it. In the hospital, very often, if you've been intubated, you can acquire Pseudomonas through even the piping in hospitals. You can unfortunately get it as well. So those things you can't often prevent, but the things at home, hot tubs, the showers, the hot showers with the steam, hot baths with steam, the bathtubs, the whirlpool, sauna, that kind of thing, you can definitely prevent. So make sure that, now obviously I don't want you to take freezing cold showers, but lukewarm where there's not enough, not really a lot of steam coming up would be the ideal in that sense. If you like sauna, there's infrared saunas. That's not going to give you Pseudomonas. So try these alternatives instead. Okay, very good questions. Very good questions. Let's keep them going. All right. What else? So another question is, so Glenda's asking about humidifier in the home because our humidity is low. So that's in the wintertime, you definitely will have low humidity, that's for sure. And the dry heat will definitely make you dry, your mouth dry, and secretions may become thicker. So again, the humidifier without the filter is your best bet. You can get them typically in the kids section, like at Target or Walmart. You just have to pour some water in, and it kind of mists, and then you're going to clean it out afterwards. The filters, typically what happens is a lot of people kind of leave them in there, and they just kind of sit in there, and they will start getting bacteria formation, even fungal formations in there. So you want to be careful with the filtered ones. The non-filtered are fine. There's another question. I had double pneumonia 2 years ago, and my COPD seems to be worse. Can double pneumonia make COPD worse? Great question. Any pneumonia, not just double. Double meaning that it was on both sides of your lungs. Even one lung pneumonia, single, or what they call lobar pneumonia, or in consolidated pneumonia, interstitial pneumonia, whether it's one side or both sides. The studies show any kind of pneumonia deteriorates your lung function afterwards. So let's say you have a certain, your breathing tests are showing your FEV1, your forced vital expiratory volume in the first second to be, let's say it's, I don't know, 0.60, which would be in the moderate range. Afterwards, let's say you just got out of the hospital, maybe it's 0.4 something. However, what is the best way to get it back? Now, there's a certain amount of lung damage you cannot get back. What can you improve? You can improve your diaphragm. You can improve your intercostal muscles, your neck muscles. So muscles you can definitely improve by improving your protein intake, your nutrition intake, your exercise, and again, pulmonary rehab. That's one way to improve your lung function after a exacerbation. So typically with pneumonia, you'll have an exacerbation. With pneumonia, you have some deterioration. So those are the ways that you would kind of improve those numbers back to a certain amount. So the biggest thing that happens after a pneumonia, remember, COPD in itself is an inflammatory condition. Pneumonia in itself is an inflammatory condition. So what happens is all these immune cells are out. They need to be fed. It's like all the Army comes out, the Navy, the Air Force, and now you got to feed all these hungry soldiers. So your immune system is like that. You now have to expend more energy because of this inflammatory cascade that's happened from this pneumonia and from the COPD. That inflammatory cascade is going to degrade your muscles. It's going to decrease your muscle mass. You're definitely not eating as much as you should be. You're definitely not taking in as much protein, as much vitamins, as much amino acids, as much vitamin D, all these things as you should be. So no amount of inhaler is going to really do much for you. So the game after an exacerbation, remember this, very important. Whether it's pneumonia or COPD exacerbation or both, typically it's both, is going to be on the exercise and nutrition level. That's where it's going to be. Because the inhalers, the nebulizers, what they're doing is improving your, they're basically dilating the tubing in your lung, right? They're bronchodilators. The steroids are kind of smooth over the inflammation a little bit in your airways, but to get back, you need exercise. And if you're not having an adequate diet, your exercise won't be on par. So it's like it goes hand in hand. So that is where I think we are really lacking right now, because the drug companies can really push inhalers. That makes them money. They're not really able to push protein. And a lot of doctors don't really even know how much protein you should be taking. But Again, you should be taking anywhere from 0.5 to 2 grams per kilogram. And it all depends where you are on that spectrum. Again, that spectrum being where you are with your BMI, your weight, where you are with your COPD. Have you had an exacerbation? Have you not had an exacerbation? Have you had pneumonia? Are you just out of the hospital? All these things account for where you should be. So that's something, again, talk to your doctor about. How much lung function improvement can I expect to achieve by intercostal muscle exercises? I have severe emphysema. Debbie, I can't answer that question fully because I have to look at your breathing test, but you can. So you can improve your lung function by a certain percentage. Again, it would be on an individual basis where you are. There's a lot of factors, not just the lung function itself. Again, we need to know your exercise capacity and other things. So hard to answer that question, but the answer is yes, you can improve. How much prednisone is usually given during a severe exacerbation? Okay, so there are typically the dose actually is about 1 to 1.5 milligrams per kilograms in divided doses. So that's really where it is. However, I'm not sure if anybody really even uses that formula. Typically, you'll get 60, when you first go in there, you'll get 60 milligrams IV every 8 hours. Some people may put you on 40 milligrams every 12 hours. That's Solumedrol, the IV form. You can sometimes get prednisone, but typically you'll be on the IV and then they'll taper you down to 60 milligrams a day on the oral prednisone. Studies show that the oral and the IV basically are adequately equal. The issue is the insurance. If you're on oral prednisone, they say insurance says, well, if you're on oral, you can go home. So a lot of times we'll put you on IV just to stay in the hospital. That's kind of an inside thing there. But unfortunately, sometimes you have to play that game. So typically 1 to 1.5 milligrams per kilogram is the answer. What constitutes a hospital admission for a COPD exacerbation versus just bed rest? So there are typically three different levels of COPD exacerbation. There's mild, moderate, severe. Those people that we want to keep at home are in the mild to moderate range as far as an exacerbation. More moderate to severe, those people end up in the hospital. It depends on your shortness of breath, your oxygen level, and typically how bad you are, whether you end up in the hospital or not. If you can't sustain yourself in the home or take care of yourself, you're going to end up in the hospital. So it's really on an individual level, who goes to the hospital, who doesn't, who stays in the hospital. Sometimes you go to the hospital in the ED, they'll give you some nabs, they'll give you some steroids after 8 hours or so. Besides the 2 hours you're sitting there in the waiting room, after 8 hours or so, they may send you home. Or they may admit you because now you have pneumonia, you have a high risk of returning to the hospital, so they want to keep you in there for 24, 48 hours. Some people, it may be longer. Again, another issue is how much oxygen are you requiring? Or are you in a respiratory failure situation where you require BiPAP or intubation? Obviously, they're going to keep you in the hospital for that. That would be constituting a severe exacerbation. And those are really the people who end up in the hospital on high flow oxygen or on BiPAP or intubated that really need to work on their diet and exercise afterwards. If you're at home and you have an exacerbation, they'll give you steroids, they'll give you an antibiotic, They may increase your nebulizers. They may get a sputum sample while you're at home. Kind of similar things what they would do in the hospital, but you're able to maintain your daily living to some degree, and that way we can keep you at home. So hopefully that answers the question. I would like to know why sometimes my numbers for oxygen saturation will be 94 and I will have a harder time breathing than when I'm at 88. Okay, that's a good question. That's a very good question. The oxygen level is just one aspect of your breathing. Other aspects of breathing, your anxiety level is another aspect. What is your heart? Is it, do you have heart issues? Is it racing? Do you have atrial fibrillation? So heart has another part of it. Mucus has another part of your shortness of breath. So are you getting plugged up? Are you not able to expectorate? Is the mucus just getting just stuck there? That's another aspect. Again, going back to your diaphragm, your muscles, where are we with that? So there's many factors in your breathing, not just the oxygen level, because you could be, like you said, you could be at 88, you're not, feel that bad. You could be at 94 and you have a hard time breathing. So those other things that I just mentioned, those are really have to be taken into consideration, meaning it's not just linear. There's a lot of other factors. Now, other things, for example, heart is okay, muscle-wise, not too bad. Well, what else could it be? Well, okay, do you have neurologic issue, for example, MS? Do you have a metabolic issue, for example, hypothyroidism? So other things need to be looked at as well, but the main issues are the ones I just mentioned. Can levoalbuterol cause an exacerbation? So typically levoalbuterol is not going to be the cause of your exacerbation unless you are overdosing on it. You can have reverse effect. So if you're taking it 8 times a day, yeah, it could. If you're taking it once or 2 or 3 times a day, 4 times a day, probably that's not going to be the cause. What are the symptoms of oxygen set too high? Now, oxygen set too high, if it's short-term oxygen set too high, for example, you're on 2 liters and you go up to 6 liters because you're going across a room, you go back to 2 liters afterwards, or you're exercising, you go up to 6 liters, it's not going to be a problem. If you are on 2 liters and you retain carbon dioxide based upon your last blood gas, or there's a CO2 level in the chemistry, the regular blood work, then there is a risk that you can retain carbon dioxide. So that can be a feature of too high of an oxygen. The symptom would be tiredness, fatigue, sleepiness when your carbon dioxide level starts going up. The other symptoms, you could have nosebleeds, you can have dry nose, dry mouth, if there's too much oxygen going in. But the main thing that we're worried about is your carbon dioxide level. So if you are a retainer, then you really have to be careful. Not everybody's a retainer, but I want to make sure you understand. There was a question earlier that sometimes with 88% I feel okay, with 94% I don't feel. So the point I want to make is that if you're short of breath and your oxygen level is in the 90s, there's another factor. There's something else going on besides your oxygen level, right? So it's not that you should turn up your oxygen level and you'll feel better. Mentally, you may feel better because now you say, okay, I increase the oxygen, my oxygen level is 100%, I feel so much better. there's got to be something else. It's not going to be your oxygen level because it's already saturated 94%, 95%. Even if it's 90%, there's got to be something else. So look at other issues. I only use my nebulizer when sick. Should I be using it every day to improve lung function? I'm at 25% lung function. The nebulizer, typically, inhalers in general, some of them have been shown to decrease exacerbations. By decreasing exacerbations, you can maintain lung function and maybe slightly improve it. The best way, if you're at 25% lung function, is not the nebulizer. It is going to be at the nutrition and exercise level. I can't emphasize that enough. The industry has made it that the inhalers are the way to go. They're not. Yes, they will help. Yes, they do help. Yes, they may improve lung function. Yes, they may improve your risk of exacerbation. Yes, that data is there. The best thing to do is really work on your nutrition, work on your exercising, stretching. Those kind of things will improve not just your lung function, but your overall health as well. So just kind of put that number one in your brain. How does a pulmonologist tell the difference between breathing issues from your end-stage emphysema COPD versus a heart problem, ischemic cardiomyopathy, and other issues? That's a very good question. So there are certain parameters. For example, if you have ischemic cardiomyopathy, that's basically heart failure. You may have right heart failure, you may have left heart failure, you may have biventricular heart failure. If you're having more right heart failure, you're going to see increased fluid retention in your legs and or maybe your abdomen. If you have left heart failure, you will have what's called orthopnea, where you can't lay down. You may need 3 or 4 pillows. You can only sit up. Once you lay down, you start getting worse with your breathing. You may have some discomfort in your chest. So on the heart level, those are the things that you may see. On the lung level, you may see increased mucus production, thicker mucus, change in the mucus coloring. You may feel fatigued. You may feel more short of breath. You may be wheezing more, coughing more, and overall just feel blah, not wanting to do anything. As a lung doctor, you have to be aware of both conditions to kind of guide the patient on which one, where should we go? Should we increase the diuretic? Should we increase the nebulizer? Should we put you on a steroid taper? Should we put you on a antibiotic? That's more the art of medicine there, and how much your doctor knows you, and how much you trust your doctor to do the right thing as well. So there's a bunch of different things that are involved in that. What is a good maintenance inhaler that does not have steroids? So Stialto is one. Anoro is another one. You could do Brovana in the neb, Upelri, Brovana. They don't have steroid. You could do Duonebs. There's no steroids there. So it all depends where you are in your stage of COPD, where you are in your symptomatology, and you and your doctor discuss which inhaler is best for you. Where can you find credible, reliable information for nutrition and exercise that will help with our condition? Nowhere and everywhere. What do I mean by that? Soon I'm going to be coming out with a plan. So there is information, and it's everywhere. You Google it, but what is the correct information and what should you use and what you not use? I would imagine, and this is unfortunate, I would imagine most physicians are not updated on really how much of this or how much of that or how much of this. The RDA recommendations are really for people who are normal, like don't have disease, don't have lung disease, don't have other disease. So that can be a base, but it's definitely not adequate for or certain things. So in the next few months, I'll be coming out with some things. But unfortunately, I don't have an answer for you because there is a lot of information, and I wouldn't say, go to Google and look it up and ask Google this or ask ChatGPT or ask AI, because the information is not as well consolidated as it really should be. So talk to your doctor. He may know. A lot of people don't. They'll guide you towards a boost or an Ensure, and that's fine. It really is. But then how much and how many cans, and do we do protein bars? Do we do protein shakes or powders? Is there other sources of protein? I'll give you another example. There's short-acting protein. There's longer-acting protein. There is powders. There is gummies and all that. Some people, it's hard for them to eat enough. Some people get bloated. Some people are allergic, those kind of things. Nuts, seeds, for example, pumpkin seeds, very high in protein. Well, a lot of people aren't allergic to pumpkin seeds like they are with like peanuts or other things. So great protein, easy to eat, easy to digest. They also have magnesium and zinc and other things in them. So, something you can snack on. But in the next few months, I'll be coming out with something for that. I have coughing spells occasionally. I check my oxygen and I'm around 94 and my heart rate goes up to 125. Is that just because of the coughing? Because it slowly comes back down. That is because of the coughing, unfortunately. And a lot of times, I'm not sure in your situation, a lot of times you can't really prevent those coughing spells. But again, talk to your doctor about it. Can COPD be cured? I think that's the question. The answer is no, COPD cannot be cured. It can be managed. And again, everyone, if you have not signed up for mynewlungs.com, please do so. You will thank yourself a million times. There's a gift 25 promotion. That's the promotion. 50% off your first month. Please do yourself a favor. The best rehab in the world. And I'm not just saying that. It's the best rehab in the world. All right, replying to Debbie, send me a message. Actually, your rehab classes are a wealth of information. Thank you, Judy. You're absolutely right. The emphasis on breathing really makes a world of difference. It's completely different for any other rehab I've been in. Absolutely. Oh my God. So most rehabs, get on a treadmill, get on a bike, 40 minutes. We'll see you later. Thank you and goodbye. That is not what we're doing. We are teaching you how to breathe, when to breathe, why to breathe, how to improve the breathing, the diaphragm, the intercostal muscles. Alex is he's like the man. So he's coming up next. I'm going to be taking off in a minute, but please join mynewlungs.com. What are the best ways to combat mucus production? Sometimes you can't, sometimes you can. There is what's called guaifenesin, in other words, Mucinex, different doses, which is basically trying to thin out the mucus. There is nebulized saline, 0.9%. There's a 3%. That helps to expectorate. Again, albuterol sometimes helps you expectorate. It opens up the airway. Then there's steroid inhalers and nebulizers, which kind of smooth out the airway, trying to decrease the amount of mucus production. So then there's a flutter, which helps to kind of move mucus around. There's a chest vest that kind of also helps move mucus around. There's Mucomist, which we kind of save for a little bit later. But there's bronchodilators, there's steroids, there's things that will thin out the mucus, things that will help you expectorate, and then things that will help you move mucus around. You may need all of them. You may need some of them. You may need some sometimes and some other times. So again, that's a plan through your doctor. Is it okay to take Mucinex twice a day long term? I would have to caution, what I've seen is Mucinex works really well for a period of time. I think you should get off of it for a period of time, and then you can go back on it. Then you have Mucinex with D and DM, and I would not recommend anything but straight Mucinex. So same thing with antihistamines. They work for a while, and then they're not working as well. What I would say is a few months after, switch it to a different one, then go back to the other one. Your body kind of gets used to certain things. So make sure you kind of switch out things, So what I would say is Mucinex, hit it when you really need it. When you're not so bad, wean off a little bit, and hit it when you really need it. And it just kind of back and forth. That way, when you need it, it kind of works optimally. I have seen a lot of people that they use it every day, and it's like, well, it's not working anymore. Well, you don't need it every day. And like I mentioned, there's 4 or 5 things that I mentioned just about getting mucus out. So it's not just one thing. Again, talk to your doctor about it and come up with a formula. I didn't even mention, sometimes I'll give azithromycin every other day. That sometimes helps decrease mucus production, decreases exacerbation. So that's another avenue. But there's many, many different ways to do that. So are you about 4 hours ahead of UK? Well, I think we're 6 hours, or maybe UK is 6 hours ahead of us. But if you're in UK, spread the words about mynewlungs.com, please. Gift 22 is a promotion, 50% off your first month. I cannot emphasize it enough. Please do yourself a favor, do your friend a favor, do your community a favor. Shout it from the hilltops, mynewlungs.com. It's that important. You'll get so much information, useful information. What about antibiotics do you choose to use? So antibiotics, what I mentioned was azithromycin. That is more, so azithromycin has not just an antibiotic, but it's an anti-inflammatory component. So that's why we try to use that more than anything else. But antibiotic choice, again, Bactrim is another one if you're not allergic to sulfa, but talk to your doctor about it. Sodium chloride was my my Duonebs in the morning. Do the job of getting, yeah, absolutely. So I would do the Duoneb first before I do the sodium chloride. One other thing, Duoneb has ipratropium, Spiriva is ipratropium with tiotropium, but similar. That can dry you out. If you're having an issue with really dry, thick secretions, you might want to stay off the ipratropium. Talk to your doctor about it, and then get back on it afterwards. All right, just a couple more questions. Helen, you're in the UK. Please let your community know about mynewlungs.com. Again, 25%, 50% off, gift 25. Please. I know the NHS is not that great over there, so people need us. Please let them know. I take 20 milligrams of prednisone every day for COPD. I don't think I would be able to get out of bed without. Also helps with other things like back pain, but I really would like to taper down. What do you recommend? Since the 20 milligrams, now that's kind of a high dose for an everyday. You know, that's not good for your eyes. It's not good for your skin. It's not good for your bones. It's really not good for your muscles. But the best way to taper is very, very slowly. And let's say you go down to 15 milligrams and you're like, oh, this is tough. Go back up to 17.5 milligrams. Then come down to 15. Go back and forth. And you keep going back and forth until you can get back to, let's say, 10 milligrams. But it may take you months to do that, not just days, but maybe take you months. All right, what else? Couple more. What should your optional be with COPD on oxygen? What should your oxygen? So if you are not a CO2 retainer, it really doesn't matter. If you are a CO2 retainer, talk to your doctor. He may want you to be on the lower end, let's say 90%. I usually don't recommend the 88% because there's not much of a buffer, and you do need that little bit of buffer. So talk to your doctor about it. If full extract cannabis oil is a good natural bronchodilator, it's off label. Let's not talk about it or go there right now. If it's working for you, okay. I don't want to get into that right now. All right, Larry, I will answer your question in the future, but I only have a couple minutes, and that's going to take some time. Helen, you're right. NHS is on its knees. That's why mynewlungs.com will help you and all the people there with lung problems. And I know the pollution is not so great there either, and the weather's not always so great. So I know there's a lot of people probably suffering with lung problems in the UK. Please shout it from the hilltops, mynewlungs.com. Again, 50% off. I don't know what the pound is these days, but it used to be like double the dollar, so you probably get it even cheaper over there than we do here. But please let everyone know in your community about it. Spread the word, and let people know, because it's really a wealth of information. It is probably the best. Let me rephrase that. It is the best pulmonary rehab in the world. In the world. Okay? All right. I'm going to take one last question. One last question. Anybody have that burning question that they have to ask right now that I can give you a quick answer with? Anyone? All right. Thank you for joining. I will do more of these question answer in the future. Again, please do yourself a favor. Sign up for mynewlungs.com. Alex will be next. So take a look at his. Debbie says, what's the best exercise for COPD? Join My New Lungs, and you'll find out what is the best exercises for COPD. Thank you, and see you soon.